Jason, thank you for coming in today.
Thank you for having me.
There are some questions I'd like to ask of you.
Sure.
First, what area or areas of nursing are you interested in, and can you tell me why?
Well, I'm interested in all aspects of nursing.
Mhm.
I have done a lot of my clinical experience within the emergency room,
Mhm.
which has always been a passion of mine. I do enjoy emergency nursing. So, other aspects I enjoy are actually psychiatric nursing
Mhm.
and med-surg nursing.
Okay. And tell me about your clinical experiences. Which rotations did you enjoy the most, and can you tell me why?
Sure. Most of my clinical hours in this program were in the emergency room.
Mhm.
So that's why I really enjoy working in the emergency room. Some of the other clinical areas that I were in was mental health, OB, and did some clinicals in an OB office for community health, diabetes education, and primary care.
Mhm. Okay. And what is the biggest mistake you've ever made, and how was the problem resolved?
I believe the biggest mistake I've ever made was going into a patient's room with the wrong chart.
Oh.
But the best way to counteract that is that the first thing that I did was when I had the chart in my hand is I said, "Can you please tell me your name and date of birth?" And when they told me that it was not so and so, I quickly knew, yes, I have the wrong chart. I asked the patient to please excuse me, let me go grab the chart, and then I would be right back, and then everything was fine.
Can you tell me a little bit about yourself, what you see as your strengths, and why?
I like to think of myself as a people person. I think one of the biggest things I think is a strength of mine is my communication. I do enjoy bedside nursing and being able to talk with the patient, walk them through it, keep them informed. I think is a great way to not only express that communication with them, but also give them the understanding that this is what's happening, this is what you can expect, and that we are here for you every step of the way. So they know what we are going to do for them versus not knowing anything.
Mhm. And how about your weaknesses?
Well, I think one of my weaknesses in a healthcare setting is I think most nurses can, maybe new nurses can attribute to this, is time management. I do try to stay on time as much as possible, but I am also, I like to think I'm very efficient. So that time management kind of gets in the way when I want to make sure everything is in order. I kind of slow down, and I'm working on that.
Okay. And tell me about a staff nurse who most impressed you, and why?
A staff nurse that I've actually come to admire very much was my preceptor in nursing school. She gave me the biggest boost of confidence I think I've ever had. Even when I was in an LPN school, I worked with many different nurses every day, but she was my preceptor in this program, has worked with me side by side through the whole program. And she impressed me very much because she was very knowledgeable. She cared about her patients, and she made sure that they were aware of everything that was going on. To me, that was giving the patient everything. And so they were more comfortable, they liked her, they respected her, and they even, at one point, several patients had written back to the emergency room managers about her wonderful care. So I felt very blessed and also very lucky to have her as a preceptor.
And how would your most recent nursing instructor describe your performance in the clinical setting?
I think she would describe me as caring. She would describe me as professional. She would, yeah, I think that sums it up.
Mm-hmm. Okay. Tell me about your most challenging clinical assignment and what you learned from it.
My most challenging assignment was with a patient that came through the emergency room and he came in complaining of shortness of breath, and that was his only complaint. So I helped triage him. We got him into a room, and at that point he did a steady decline. And the challenge became much more at that point because me coming into this emergency room setting, which actually with this patient was my first patient on my first rotation, my first day of clinical. So I was not expecting something so severe to happen as him, like I said, declining into a myocardial infarction. So that was probably the most difficult thing to see and be a part of. Because at that point, I did not know everything I needed to do. So that watching the nurses kind of gave me that edge and let me see what to do at that point.
And what skills do you feel you've gained from your past work experiences that may help you in this position?
Well, I am becoming an RN. And before this, I was an LPN. And before that, I was a nurse's aide. And so I believe a lot of what I am able to accomplish with my new position is my assessment skills. I think that has been the greatest challenge, but also the greatest achievement out of my program. So I learned a lot of new skills, but I've also learned to hone in and enhance my assessment skills.
And tell me a little about yourself and how would others describe you?
I think that people would describe me as a very kind person. I do like to do community service. I do a lot of work to help other people. And what I mean by that is I like to just ask people, do you need help? What can I do for you? And, you know, that is on my own time. That's not work time. But at work, I kind of just put the same thing forward because, you know, an efficient place is not ran by just one person. And if one person is struggling, it's always good to say, hey, you need an extra pair of hands? Do you need another set of eyes to look at some things? I think that is something that everyone can benefit from. So I try to push that in.
Okay. And what are your future career plans? And where do you expect to be in 2 or 3 years? And how about 5 years?
My future plans are to advance my degree. I earned an associate's degree. My plan between now and 2 to 3 years is to become a bachelor's prepared nurse and then move forward into a master's program. I would eventually like to teach nursing and also work as a family nurse practitioner.
We do not have any openings at the present time in the areas in which you have indicated interest. Would you be willing to accept a position in another area? And if so, what other areas interest you?
Well, experience is a virtue, I believe. So I believe that as a new nurse, I can start anywhere. My passion is emergency or med surg, but I also realize that starting somewhere to get a little further is helpful. So I would not mind looking into maybe psychiatric services or maybe even labor and delivery.
And tell me about a time when you had to establish priorities during one of your clinical experiences.
I will go back to that very first experience. I had this patient come in. He was my first patient. In fact, he was my only patient at that time. So the priority was his airway when he first came in. The second priority was to assess why his airway was not allowing him to receive the oxygenation that he needed. So when the steady decline came, the next part was communicating to another staff member, there's something else happening here. Let's get the ball rolling. I need some help.
And tell me about a time when you went out of your way to assist a family or patient, even though you really didn't have the time.
There was a patient who was in need of a ride home, and their family was not there. Their family was on the way, but they were 3 hours away. And the charge nurse kept insisting that you need to discharge this patient. You can call them a cab. You can call someone to see if they can come pick them up, a friend or a family member. And as I stated to her, the families were not very close by. So what I told the patient was that I will discharge you, but at this time I'm going to take you out to the lobby. I'm going to assist you in calling a cab, and we will take that. And as long as you are okay with that, we will take you out and we'll do that. And the thing that was very nice at that point was that was an unexpected mentioning on my part to the patient. The patient did not expect us to do that. and was actually quite grateful because they were ready to go. They didn't want to wait on their family. And at that point, the medical receptionist at the front of the emergency room had a cab voucher, so we were able to give them their free cab ride home.
Good.
So if you don't mind, I actually have a few questions for you. Okay.